Good afternoon. Thank you for joining me this afternoon to talk about a new business idea called the Vein Finder. So most vein finders are products that do just that. They're designed to help a trained provider see where a vein is under the skin. They don't do any more than that. Now, Vein Light devices are truly vein access tools and have been clinically proven to improve vein access success rates. Why are Vein Light products superior? Well, because their patented design reveals both the vein and the surrounding venous structure, while simultaneously acting as a tourniquet and prevents veins from rolling. Therefore, we have decided to form a strategic alliance with Veinlight to produce a lower cost version that will enable more medical staff to have the device on hand when needed. The current cost is $270. More medical staff would purchase if the cost was below $150, leading to fewer IV access failures and less sticks for patients with difficult veins, such as those that roll, those that have dark skin, tattoos, those that are obese, infants, and elderly. Now, nurses will gain confidence due to the increased success of draws and IV insertion. The lower cost means it will be more affordable for nurses or medical facilities, and this will ensure greater patient satisfaction and more reliable insertions or draws. Providing accurate and successful blood draws will increase blood donor satisfaction and will encourage more people to donate blood. This will in turn help increase blood supplies needed in the United States. With rising medical issues, this will also help more patients as the need arises. Higher success rates with blood draws for labs, donation centers, and medical staff creates higher customer satisfaction and greater market penetration. The Vein Finder is easy to use, holds the vein in place while inserting the needle, which avoids rolling veins. It highlights the veins below the skin to reveal accurate location for placement. There are 3.8 million registered nurses in the United States, with almost 85% of them working. And there's also an additional 15% of an annual growth rate expected through 2026. The total available market, as you can see, there are over 6,200 active hospitals, 7,100 urgent cares, almost 38,000 medical labs, as well as over 9,000 outpatient surgical centers, and over 1 million doctors' offices in the United States. Most medical offices or facilities would benefit from this device, in addition to all the blood donation centers and blood mobiles. So how many devices do you think we might need? Our best guess right now is about 2 million units needed to service the medical industry currently. The served available market, most healthcare services involve some sort of care by nurses. Registered nurses are in high demand in both acute care and community settings, including private practice, health maintenance organizations, public health agencies, primary care clinics, home health care, nursing homes, minute clinics, outpatient surgical centers, nursing school-operated clinics, insurance and managed care companies, schools, mental health agencies, hospice, military, industry, nursing education, and healthcare research. Obviously, we have an extraordinarily large served available market. There are two segments that would greatly benefit from this product. The first segment is medical personnel working at facilities that need to either draw blood or insert IVs, such as hospitals, doctors' offices, urgent care centers, blood donation centers, and surgical centers. They have a variety of patients that each have unique needs and may feel frustrated when attempting to care for their patients. The Vein Finder allows them to accurately and confidently place an IV or draw blood. This also holds true for our next customer segment, which is dental surgical staff. Oral surgeons and periodontists have a growing need for accurate placement for IVs prior to surgery. Most patients are already highly stressed and anxious when having oral surgery, so the utilization of a Vein Finder will allow for quick and accurate placement of an IV. Our Get, Keep, and Grow strategy with our customers is that we would first offer lower price devices that assist with efficient and accurate insertion of IV or blood draws, limiting product waste from multiple sticks and valuable time. Then we'd be offering sizable discounts for referrals to other nurses as well as free shipping. And then we would grow this relationship by creating a viral loop, offering free product after a certain number of referrals, and upselling by offering device options, which include units that are specifically made for dental, neonatal, and small children. The Vein Finder will be a direct distribution product. We will produce a lower cost product directing at nursing, EMT, medical staff, and others through purchasing via an online website. Bulk orders will receive discounts and free shipping, and if needed, we can utilize drop shippers to assist in procuring orders and shipping out products. We will then experience higher profit margins if the Vein Finder is distributed directly from our manufacturer or warehouse. And if needed, direct sales teams could work directly with nursing schools, emergency medical services, and blood banks to get higher infiltration. Orchestrating a strategic alliance with Veinlight would be the most and best potential partnership opportunity for Vein Finder to pursue. Since Veinlight is the leading supplier, joining forces and incorporating a lower cost device will allow for great market penetration, utilizing the Veinlight name and brand success. Risks may include the potential for differences in business culture, potential uncooperative leadership, difficulty with contract negotiations, sales team merger challenges, funding for low-cost research, and development options. However, the rewards would include greater market appeal through introducing a new product line, greater market saturation within the medical community, established and existing reputation for excellence in product development and customer service. Some of the two key resources that we thought were most important were first the intellectual. We need to patent our device prior to any alliance with Veinlight. This will give us full rights to the production and a higher percentage of profits. Veinlight will benefit from increasing their product line and having a product that can be more widely distributed, as well as increasing their profit margins. And the second resource would be physical. We determined that since Veinlight corporate headquarters are located in Sugar Land, Texas, it would be advantageous to take our product development team to that area. Most consumers will be purchasing from the website, Amazon.com, or other distributors, and website development will need to include the new affordable product line that caters to nursing staff, laboratory, phlebotomy staff, etc. Suppliers will be utilized from Veinlight's existing providers unless we are able to procure contracts with suppliers that provide better products, pricing, and reliability. New machinery will need to be purchased for the manufacture of the new product line unless overseas production manufacturers can be found and produce a high-quality product with high-quality materials. Two key activities have come to light, and those would be first, and the most important, which would be research and development. We need to first identify how to recreate the Veinlight product for a lower cost. And then secondly, once R&D determines how to duplicate the Veinlight technology, a low-cost version of the Vein Finder will be created for our MVP. Once developed, overseas manufacturing will be contracted until we are able to join forces with Veinlight and form a strategic alliance. The annual assumption is that we will be selling 10,000 units at $150 each. Commissioned sales forces will take the product to market, and laborers will manufacture the product at a warehouse facility. Fixed costs are high at $815,000, so efforts will be made to contract with an overseas manufacturer. Vein Finder is an asset sale, so this will be a direct sale revenue stream. Initially, all devices will be sold by sales agents at a 6% commission to nursing staff on an individual or group basis. When sales increase, we will branch out and sell to hospitals, blood banks, ERs, labs, surgical, and dental facilities. The Vein Finder will offer equal quality at a lower price of $150 to make it more accessible to nursing staff. This is $130 less than the comparable Vein Light model, which sells for $280. Our intent is to raise awareness of a need for a low-cost, effective device and thereby form a strategic alliance with Vein Light. Now, operating costs are our largest financial drain on the business. These include the lease on the warehouse and executive offices, the payments on our equipment, paying the VC loan each month, executive salaries, and lastly, utilities. These total fixed costs come to, as you can see, a total of $665,300 annually. The variable costs that represent the largest outflow are sales commissions, direct labor, direct materials, and sales tax totaling $562,000 annually. All costs are calculated based off the figures determined in the cost assumptions and income statement spreadsheet. After our interviews, we gained several insights. Initially, our value proposition was well received, and it being seen as something that's highly needed by patients and medical personnel. Nursing staff interviewees said that they would purchase their own if the cost was lower. However, they preferred it to be an already established piece of equipment in each patient room. Customer relationships and customer segments. The consensus was that this was mostly needed for nursing staff, predominantly new nurses, emergency personnel, and ER medical professionals. One patient even said she wanted to have her own to avoid multiple sticks when donating or visiting a lab. Key activities for the Vein Finder. The nurses reported that they liked it, that it worked for all types of patients, and it was effective and reliable. Some thought it was a complete waste of time, and that touch was better than using a device. Majority were happy to use it in critical care units where veins were most difficult to detect. Emergency medical personnel thought that this would be vital to their success in their jobs. Key partners and key resources. There was actually no one I spoke to who cared about who we would partner with or what resources we would use. They only wanted the device to be available and in the hands of nurses when needed. And lastly, our cost structure and revenue streams. Majority felt it would be more readily utilized and purchased if the cost was lower and the reliability was certain. Medical director that we interviewed said he didn't care about the cost as long as it solved a pain in his office. The dominant forces, market forces, are the nursing staff, emergency medical teams, pediatric surgical units, and phlebotomists. We will need to focus on these segments by making a lower cost yet highly reliable device. The Vein Light company dominates the industry. There really aren't any other competitors that come even close to their patented technology, and it would be in our best interest to replicate this technology to create a lower cost device that would more fully saturate the market and be widely available to customers. Customer satisfaction is becoming a growing key trend. The happier the patient, the greater the customer satisfaction. If nursing staff want to please more patients, having this device will help them to have more confidence and administer less pain to patients. And lastly, microeconomic forces include rising manufacturing costs that may potentially be lower if contracted overseas. Funding can be obtained through angel funds or organizations looking for medical innovation ideas. Now, in doing the SWOT analysis, we found some interesting results. For our value proposition SWOT assessment, the strengths were that we would be providing an affordable device for medical staff. Weaknesses are the R&D or the research and development time and costs could be high, and can we really produce it for less? Opportunities are, it would saturate the market if it was successful. Threats would be, initially, if Vein Light offers one before us for less, before we create a strategic alliance. Next is our revenue and cost SWOT analysis. The strengths would be if we could contract with an overseas manufacturer and get lower costs, and selling direct